I want to take the opportunity. We left all the lines open coming in, so I see a lot of different folks coming in. I see Dolores and Alan and others. So how about if you can quickly introduce yourself? That would be great. Your lines should be open, and it would be love to hear who we have on the call so far.
Hi, I'm Nordia. I'm with Emory University in Atlanta.
Hi, Nordia.
Hello.
Hi, I'm Ellen Duffy from the New Jersey Department of Health, the Rhine-White Part D program, and the New Jersey Cross Park Collaborative team leader.
Hi, Ellen.
Hey,
good
Ellen.
to have you.
Hi, how are you all?
Good.
What else do we have?
John from Elmhurst Hospital, Kasuma.
Hi, John.
Hey, John.
John was telling us earlier that he's from Queens, from Elmhurst, or he's associated with the Elmhurst Hospital there. So.
Cool.
Anybody else? I see here Chuck. Chuck, can you introduce yourself? Yeah, you should be unmuted. We also have Dolores. Anybody else who joined us and hasn't introduced themselves?
Hi, this is Dolores.
Hi, this is Liza Flynn, and I'm from Harborview Medical Center Medicine Clinic in Seattle, Washington.
Wonderful. I didn't catch your first name. My apologies.
Liza.
Liza. Hi, Liza.
Hi. Welcome.
Hi, this is Dolores Dockery, one of the N2C coaches.
Hi, Dolores.
Hey, Dolores. Welcome.
Hi, how you doing?
Good, good.
Good.
We saw several people dialing in using your phone. It would be great to hear from you. And a warm welcome to all of you. For those who have not introduced themselves, if you can quickly state your name, where you're calling from. We want to create a community of learners, and I think getting to know each other is probably a wonderful thing to do up front. Who hasn't introduced themselves as of yet?
Clemens?
Yes.
Hey, hi, this is Chuck Olas calling from Memphis.
Hi, Chuck.
How are you doing?
Hey, Chuck.
Good.
Hey, Emily, how are you?
Good. How's it going?
Great, great. I've been spending the morning looking over these materials, and it's really exciting. The lit review and the slides and everything looks really good.
Oh, we're so glad that you're well prepared. So any questions, I will point them to you, Chuck, huh?
Oh, great. Sounds good.
Don't worry. For those of you
I'm just typing the...
Go ahead, Emily.
I'm sorry, Clemens. I'm just typing the web address to the end+disparitiesexchange.org. I put it in the chat box. If any of you haven't seen that website yet, or if you're not familiar, you can just go there and review some of the materials that Chuck was referring to.
Do we have anybody else who has not introduced themselves yet? I see a couple more other names and some other folks who dialed in.
Hi, this is DK Gurung. I work for DC's Department of Health.
Hi, DK.
Welcome.
Thank you.
This is Clemens Steinberg. It's 1 p.m. Eastern Time. We have probably wait a few more minutes to allow other folks to join us. A warm welcome to all of you. I am Clemens Steinberg. I'm the director of the National Quality Center, and we just want to get going by hearing who do we have on the phone, and you probably see the names listed on the participants. That's a panel on the right of your screen if you are in WebEx. And for those of you who are not afraid to show and use your camera, I would encourage you to use the camera function if you have one. I know there's sometimes firewall restrictions and whatnot, but we would love to see who we talk to. Our presenters, I see several people have already used the camera, but we would love to hear from you. So who else do we have on the call that hasn't introduced themselves?
Ann Price with the University Health System in San Antonio, Texas.
Hi, Ann.
Hi.
Hi, this is Jeremy Havarnan from the Phoenix CMA Rhine-White Part A program.
Hi, Jeremy.
Hi.
Just make us jealous about what the weather is in Arizona.
It's beautiful. I'm sitting outside right now.
Oh, wow.
Yeah. I pulled out my sweaters this weekend. Ugh, it's getting cold now. We had a nice hot week in Maryland, and then now it's going to be cold, chilly. I think tomorrow is a high of 56.
So sorry about that.
Yeah, that seems sincere.
Well, you have not heard from Christine. Christine, do you want to quickly introduce yourself? You may be muted on your line. We would love to hear from those that, if you can quickly introduce yourself. We get more and more folks on the call, which is wonderful to hear. So I see a couple more other. Jerry, you on the phone as well. Do you mind quickly introduce yourself?
This is Lydia Barakat from Yale University. Hi, Clement.
Oh, my God, a voice from the past. How are you doing?
I'm so happy to be back joining in.
Wonderful.
I'm doing very well. Thank you for keeping me on your email list.
You know, we never drop one. I hope you're doing well. We still have very fond memories of you participating in our fellowship, so great to hear your voice.
Thank you.
We probably wait 2 more minutes before we get going. This is a very loose agenda. A quick reminder that if you go, as your chat room should be open to the right of your screen if you're using our WebEx webinar platform. We have listed our website for those of you who have internet access, end+disparitiesexchange.org. That's our initiative-specific website to really access all the various materials. We'll cover some today. Just as a quick reminder, today is really an opportunity for Ask Any Questions, to maybe dive into some of the questions you couldn't ask yesterday. And I know from Chuck and others, they looked already on the website and studied some of the materials. So we would love to hear if you have any questions. Anybody else who did not introduce themselves?
Yes, I'm Gladys Jennerjan from the A Center of Orange County.
Hi, Larry. Yeah, I just joined in. My name is Judy, and I'm with the Prince George's County Health Department in Maryland.
Wonderful. Do you mind stating your first name? I didn't catch that.
Oh, it's Jide, J-I-D-E.
Jide. Okay. Good to have you.
Hi. This is Susan Tesher from the Kansas AIDS Education Training Center, or MATEC.
Hi, Susan.
Hi. I'm having trouble getting in on the website, the Connect piece, so I'm just on the phone.
Okay. Okay. So.
Hi, this is Tiffany.
Hello.
Hi.
Yes, I hear you.
Hi, this is. Hello.
Go ahead, if you want to introduce yourself.
Hi, this is Annette from AMA, Denise Figueroa.
Good to have you.
Hello.
Yes.
My name is Alex Valencia from the ACQC.
Hi, Alex.
Hello, just want to make sure you have Gladys from ACQC as well.
Wonderful.
Good morning. This is Antoinette from Ryan White Part CD in Tacoma, Washington.
Very good. Hi, Antoinette.
Hi.
Hello, this is Christine Kibui from California Department of Public Health.
Hi, Christine. So it's about, on my watch, it's a few minutes after the top of the hour. I think, Emily, how about if you get going, and we can certainly break at certain points to welcome all of you. Again, a warm welcome to all of you. This is our first office hours for our newly launched initiative called the End+Disparities Learning Exchange. And we are happy to have so many of you on our office hours. We launched our initiative yesterday, our webinar. And David, I think if you don't mind to actually mute your line, otherwise I will do that from our end here. I'm going to mute David's line. So again, I'm Clement Steinberg. I'm the Director for the National Quality Center. Excited to have you. This is really a forum where you can ask a lot of questions, and it's certainly happy to have so many of you. Let's do the following. If you can quickly type in your name, organization, city, and state in the chat room for those of you who have access to our webinar platform. And I see you already that Mona put this in. Thanks so much, Mona. And while we're doing this, Emily, do you want to quickly, our partner at the federal government, so Emily Chu, do you want to quickly introduce yourself, and then we get the ball rolling?
Sure. Hi, everybody. This is Emily Chu. I'm from the HIV/AIDS Bureau in Rockville, Maryland. I serve as the project officer for the National Quality Center. I have the luxury of working from home today, and so you might see my special buddy who's asleep behind me. My dog Murphy is joining us for office hours today, so it's a special treat. But I'm happy to be here and kick off this initiative with you guys, so I'm looking forward to it.
Wonderful. So before we get going, a few etiquettes just for any webinar that you probably have been part of. A quick reminder, we are recording this session. We wanted to develop a FAQ document afterwards, so it will help us just to document your questions and hopefully our answers, and it will give us a good sense of where the questions are. Anna, if you don't mind, Anna, to actually mute your line, that would be helpful. I'm just going to mute your line. So another etiquette is that we want to use the chat room. So we leave all the lines open. That means there will be some probably noise along the way, but I just encourage you to use your own mute button that you have on your phone, just in case that we don't have all the distractions. We want to leave all the lines open because this is really a dialogue-based exchange. So yesterday, we started our learning exchange. So some of you did join the call, but can a few people probably hear this or participating today? Can you quickly share your reflections from yesterday? I know, Chuck, you were on the call. I heard some other names seem very familiar who were joined us yesterday on our kickoff webinar. Anybody, just some reflections from yesterday? Chuck, I know that you were talking earlier on this call that you studied some of the materials. Do you want to quickly share where you looked up the materials and which one you reviewed?
Sure. Yeah, I looked the materials up on the end+disparities website. I took a look, first of all, I looked at the slide set, which I think is really excellent. I plan to, in fact, I've already downloaded it on my laptop. I plan to go ahead and utilize that for our next Quality Management Committee meeting. I think it really highlights the disparities really effectively. And then, of course, I looked at the calculator, and I've also reviewed the lit review, which is also really excellent and gives you a little bit more background. When you're running through your slides, you have some more background to refer to where all the data is from. So it was really, really great. It looks like a package if you gave us both the meat and the potatoes, so I'm excited about it.
Let's hear from one other person who may potentially joined yesterday and some of the reflections, maybe a tool or some of the aha moments that you had from yesterday's webinar.
This is Antoinette. So I also went to the end+disparities website. I'm talking with our QI specialist. We're going to use the slide sets, and we're actually going to present it at our staff meeting so that it's not just the quality team that's made aware of the disparities. Also, I shared this information with some of our community partners, so our local health department as well as the Pierce County AIDS Foundation, because I was in a meeting last week when we were talking about health disparities, particularly amongst our youth and our transgender population. So this was all very timely, and I shared that with them, and the feedback I've gotten was that these resources are very helpful for them as well.
Wonderful. Thanks for your testimony. Anybody else who joined yesterday and maybe want to reflect a little bit what they learned or maybe how they want to utilize the information that were presented?
Hi, Clemens. This is Ellen from New Jersey.
Hi, Ellen.
And for New Jersey, I will probably definitely present this info at our quarterly cross-part meeting, since our current cross-part collaborative that we've been following as the measures we collect every other month ends in December. So this obviously just leads into what our next project will be for the entire state of New Jersey. So I think it could be exciting for New Jersey. We know our greatest challenge is our youth who are 19 to 24. So being Part D, it definitely is going to be a project my Part D network will take on, but then I think probably it will expand to the entire state because that is our struggling population with retention and viral load suppression. So it'll be our focus.
Thank you, Ellen. Anybody else that joined yesterday's call and want to share a little bit the aha moments from yesterday's webinar? Okay, so how about the following? I will quickly go through some of the things that we talked about, and I will do that in a very broad overview, and then hopefully you may have some questions, and then maybe we can use Chuck, Annette, and Alan to see a little bit about the use and go from there. So, as you know, the Learning Exchange is a 9-month informational initiative to really work towards addressing HIV disparities. We are providing monthly webinars. And so this is actually the first question we got a couple of times yesterday, so let me clarify. So there are monthly content webinars that are on our calendar already. If you go to our website at end+disparities.org, you see all the lists of webinars. They usually occur on the third Thursday at 1 p.m. Eastern Time. And the topics have already been developed. So if you look through our calendar, you actually see which of those probably are most relevant to you. In addition to the webinars, we also have office hours. Office hours are held weekly, as this call is our very first one. They are 1 hour long, and they really try to be more interactive and really go with the questions that you have. We also providing Partner in Care, our consumer component, that really helps for consumers to have a role within our Learning Exchange. And we will have webinars and other activities. And we're going to talk a little bit more about that. So we will have our first webinar on November the 18th, and we will further post that on our website. We also talked about ShareLab, one of our ways to share your improvement strategies. It's an online platform to report your improvement activities related to addressing HIV disparities. We also developed a poster that is basically a template. So this will be probably introduced in a couple of months from now, where we really want you to highlight your story, your quality improvement journey, and highlight some of the successes so others can learn from it. And lastly, we developed several tools. And I may go into a few because I think Chuck and others mentioned them already. The first one we developed was our disparity calculator, which is a very powerful Excel spreadsheet that allows you, by entering key data points for the 4 subpopulations that really are the target for this Learning Exchange. And if you enter those for your viral load suppression rate as well as for retention, it actually gives you a response to the question, are there disparities in which of the 4 subpopulations may or may not have a significant disparity as the starting point for further discussions. We also developed an intervention grid, and so that was really our way to highlight some of the evidence-based and evidence-informed interventions that are currently available, that is based on our literature review as well as informant interviews that we have conducted in preparation for the launch of this initiative. So this is a lot, but I'm going to stop here. And do you have any questions related to any of the tools, any of the offerings that we have for you? And just please speak up. And if you, some of the lines are muted, so you probably have to unmute your line. But we'd love to hear some of the questions or comments you have.
Clemens, this is Ellen again.
Sure.
My question, I think, since this seems to be quite different than other things that I've been involved in that you have done together in the last 8 years, actually. In this, you're really looking at us utilizing some kind of tool to focus on either, you know, one of those populations or all of them, depending on your need. And you're looking just on, you know, to either help us gather tools to be able, what interventions we can use on our clients, and then just, you know, share the successes or the failures as things could happen. Is that what this is kind of more about than actual, what are the numbers? Even though I know we have the disparity calculator since, you know, it came from here. It started here anyway. Is that what this is more of, this type of initiative you're doing? So I just want to make sure I'm on track.
Oh, wonderful. Thanks, Ellen, for a great question. So this is really a more informational-based initiative. There's no requirement for reporting. There is no requirement to participate in any or all of the webinars. We hope that you take advantage of all our offerings. In terms of the calculator, I heard a great quote that we use all the time in our trainings, which is, data should be a guide, not a grade. And I think we want to use our calculator to really help you, based on all the data that you have, which is the one key subpopulation that really requires us to look at and end disparities, because we believe that ending disparities will help us to end the HIV epidemic. So the calculator really helps you to figure out, as you know, Alan, to really figure out which is the one population that really requires your attention. And it's a recommendation that you really pick one of the 4 subpopulations, whether it's MSM of color, it is youth, age of 13 to 24, African American and Latino women, or transgender. We believe that those 4 groups are really worthy of our efforts, and we'll encourage you to pick one of the groups over the next couple of months, and we can, and hopefully the tool can help you.
Okay, thank you.
Sure.
Hey, Ellen and Clemens, I just wanted to add to that. So from the HAB perspective, we know that this is something that's really different than what NQC has offered in the past, and that was kind of our driving factor. We heard a lot of responses at HAB that recipients feel really overwhelmed, and they weren't sure, you know, what, if anything, extra they would be able to participate in, but they were still hungry for more information surrounding disparities. So that's why NQC was really creative in terms of launching this idea and really meeting you guys as recipients where you are and offering you this information. We had already previously developed the Share Lab tool, and so we haven't really uncovered the true potential of that. That's going to be this really great sharing resource that you guys as recipients and us as federal partners and NQC can all be in this dialogue together about interventions surrounding any disparity or really any other subject matter area. So I think that this learning exchange is going to help us best capitalize on some of the materials we already have developed, and then also really allowing you guys as recipients to drop in, drop out, be as little or as much involved as you'd like to be, and really learn as much as you need to in order to do your job more effectively and meet these populations that we know are commonly underserved. So good point, Ellen. This is something totally new and different, and we're excited, and I hope that that kind of makes you guys excited too. But yeah, you're right. It looks different than other initiatives we've done before.
A question that came up in the chat room by Lydia was the question about, are the materials on our website? And the answer is yes. We are all the training slides, the slides that are associated with this initiative. You can go to end+disparitiesexchange.org, and you can find a couple of things. So one is you can find the slides from yesterday that we used, so you can download them in PowerPoint, use them in presentations. Chuck and Ellen and others said already they in the internet they will use the slides in their future quality management and staff meetings. We also have we'll have the recording from the webinar yesterday available very soon for those who missed the call. And we also have available a literature review. Chuck mentioned that already. There is a written document that is our literature review. There's also a slide set that is our slide set for the literature review, so you can take those. It's a long slide set, so you may want to probably, depending on how much time you have, to really cut down the slides. They're focused on disparities in HIV care nationally. They focused on the 4 subpopulations. And we try to make it as interactive as possible. So we have a quiz and some other things in there. And if you look at the notes section, it actually gives the answers to some of the questions so you can engage the audience. So what other questions do we have from yesterday? And then maybe we can talk a little bit more about the disparity calculator. I'll talk a little bit more about that. Any other
Clemens?
Yes, go ahead, Doug.
Yes, sir. I was just, I just want to give an example of how I kind of thought it through and how I would like to use the program. At our next Quality Management Committee meeting, I'm planning to show the slide set and also show the video just to kind of get some thoughts and some conversation generated there. And then what I want to do is take the calculator and go ahead and plug our numbers into the calculator. And then as a committee, we can choose which subpopulation we want to focus on, and then we'll go ahead and challenge, the individuals there to think about developing some specific interventions for those subpopulation or the subpopulation that we choose.
Great. Chuck, did you have a chance to look at the video that you're referring to?
Yes, sir, sure did. It looks great. It's 3 minutes, and it's really nice, well put together.
So did somebody else looked at our website and saw the video that's posted on end+disparitiesexchange.org? Did somebody else saw the video? Our Emily Chen, do you want to talk a little bit about what the video is all about, since you were instrumental in helping us to get the video together?
Sure. So our video can be found on our homepage of our website. If you scroll down a little bit, there'll be a little YouTube video of it. It's 3 minutes long, and it sort of gives a very broad overview of why this is an important topic, why HIV disparities need to be addressed, and how we are working towards it. And it's very good for giving a broad, quick overview and engaging, bringing people in. It's very engaging and I thought it was a very well done piece. Also, John just brought up the question in the chat room. He's looking for the webinar slides from yesterday. They're actually posted under the event page for that specific event. So you would have to go onto our website, into the event calendar, and go to yesterday's event to access the slides. I'm thinking that we can also post them under our resources tab so that you can find it in multiple places to make your lives easier.
I know, Annette, you were talking earlier about some of the use of how you want to use it. Can you talk a little bit more about how you want to use some of the materials? You start talking about that already. I think Chuck made a good case about how to utilize the various offerings.
Yeah, it's a bit similar to what Chuck had mentioned. So we want to get some thoughts and feedback from the team and then show them our numbers, and as a team decide which subpopulation we're actually going to focus on, rather than coming to the table and saying, here's what we found, here's where we're going to focus, let's create a PDSA or a strategy. So we're going to try to make it as participatory as possible. And again, it's very similar to what Chuck said. We'll present this information to the team. we'll discuss as a team and then make a joint decision on how we're going to move forward.
I think, Annette, I would encourage you to look at the, and you may have thought about that already, but look at the literature review slides. I think they are summarized a little bit in the kickoff webinar slides. They're embedded there. But if you want to look at more detailed literature reviews, then the slides may help you to find it. So.
Okay, I'll do that. Thank you, Clemens.
And also, I found on Annette that when we did presentations, that to start out with the slides, start out with the video, and test it probably before to be sure that it can be heard as well, not just visually be shown. That it may be a good starting point as a discussion and a little bit of an introduction to the topic of disparity. I see it as a really good discussion point and start out with and what people's reflections were after.
Okay, I haven't seen the video yet, but I'll definitely take a look at that.
Yeah, maybe a good way to actually start out and show the video. It's only 3 minutes, as Chuck and Emily indicated, but it's really a good point, and it sets the right tone on where you want to go.
Okay.
Let's hear from other folks about, do you have any questions about the learning exchange, even the very basic questions, since we are just at the very starting point. If something is not clear to you, what we are all about, how we can help you, it's your moment to ask us any questions. Please feel free to speak up, and if you can quickly introduce yourself, that will be helpful. Everybody's too shy, everybody's too with the Friday, and it's getting late already. But we will really help. This is really your forum to ask questions, so we don't want to just go into the various details. So we really want to be respecting your needs for this call. So please speak up. Let me talk a little bit about our disparity calculator. We got several questions yesterday, and it is something that you can find on our website. It is a Excel spreadsheet that you download, and what it actually does is it has the 4 subpopulations that are part of our focus for this learning exchange. Again, it's MSM of color, it is youth, it is African American Latino women, and it's transgender. And what we want you to do is to enter the viral load data, numerator and denominator, for the viral load as well as retention. So that's 8 data points. Plus you want the total number, that's the entire caseload. So if you take those 10 data points, and what you do is by entering those 10 data points, the Excel spreadsheet will automatically calculate and indicate to you whether or not there is a significant disparity given the information that you provided. I think, Annette, you're very close to the mic. Let me just quickly. Okay. I wanted to be sure that once you enter it, it actually tells you whether it's significant disparity, whether there's a potential disparity, or maybe disparity. Let's hear. I know, Alan, do you want to talk a little bit? Have you used the disparity calculator? I know you did. But if you can tell us a little bit more about how it went, what some of the lessons learned from entering the data.
Yeah, actually, I have used it here in New Jersey. Actually, Michael sent it back and forth to me a couple of times because I was beta testing it, and I found some things. Yeah, we used it, and we looked at it, and I mainly, actually, no, I think I did put the all of the cross-part data from all of the agencies because I used one of our last submissions I had at that point that I was looking at, you know, the frequency and the viral load suppression data that we had, and definitely for New Jersey, our youth is where disparity is occurring, that 19 to 24 range. And right below that is your 13 to 18, which isn't shocking because they're turning into that adolescent age group. And then the next age group, the mid-20s, is where we're finding our disparities, which is our cross-part figured that's where we're going to try to focus our efforts on viral load suppression at the end of this round of data we've been doing for the H4C, and that we would look at, you know, the clients who weren't in the cohort or, you know, who didn't get virally suppressed. And for those who don't know what I mean by H4C and cohort, it's a special collaborative New Jersey has been in for the last 2 years, I think. Okay. So it did work, and it definitely showed where disparity is. For us, it didn't show me something. It just further affirmed for us in New Jersey that this is where our issues are. So it's not hard to use. It's just the process of getting it collected, your data. So if you're a single agency, it's not difficult. For us, it was luckily for us, we've been collecting this data, so we were able to calculate it for New Jersey. Where I was. I haven't shared it, which Terry's on the call and probably saying, what are you saying, Ellen? So it's, and Terry's mentioning something in the
yeah, I see it.
That there are some issues. Yeah. You really have to look at the disparity when you run it, because depending on the size of the population, you know, your numbers could say it's a disparity, but, you know, depending on the population. So make sure you really look at your numbers and everything when you are doing this. Just saying, and I'm not a statistician.
I think, Ellen, you bring up a really good point, which is that you don't have to be a statistician for using our disparity calculator. It is something that if you have your data points, and once you have that, it takes probably 10 minutes or even less to open up the document, entering the data, and then you actually see where disparities fall. And I think that would be a good thing to do early on as part of our end disparities journey to really learn more about that. Let's hear, I think it's we are at the halfway point of our first office hours, so maybe we can take a quick stop and maybe we can hear from those who have not had the opportunity to introduce themselves. We heard from a lot of folks already, but if you can quickly introduce yourself in terms of where you're calling from and your name, that would be great.
This is Chris Scope. I'm calling from MUSC in Charleston, South Carolina.
Wonderful. It's good to have you. Can I ask you a quick question? Are you actually doing some disparity work already, or is that will be your first endeavor?
Yeah. This will be actually our first endeavor. I've sort of looked at it with Barbara, but we've never really, I'm trying to get our database and the understanding of how to pull the information out and use it in the worksheet.
Wonderful. Wonderful. Good to have you on the call.
Thank you.
Let's hear from some other folks about if you can quickly introduce yourself. You probably have to unmute your lines.
Clemens, this is Judy Popkin, MQC coach.
Hi, Judy.
Hi there.
Good. Judy, quick question for you. Do you have any other reflections from the call yesterday and to tell others who may not have had the chance to participate yesterday?
Well, I think it was a really well put together presentation, and so much of the work, it's such a nice package deal, if you will, that if you follow the instructions and there's copious amounts of directions, and it really is a simple process to do the calculations, and I really like that. And I'm looking forward to sharing it essentially with my regional groups who, you know, are anxious to maybe look at something else besides, you know, viral load suppression. So I'm looking forward to it, and I've been communicating with everybody in Florida and Georgia to encourage them to tune in. and take advantage of this unique opportunity.
Okay. Thank you, Judy. Let's hear from some other folks who haven't introduced themselves.
Hi, Clemens, can you hear me? This is Dolores Dockery.
Hi, Dolores.
Hi. So I was on the call yesterday and very excited about the involvement of consumers in the end+disparities learning exchange. And I was glad to see that I even recognized several of the spokespersons that will be involved in the process as we move on. So one of the things that we're going to do, I am also a member of I chair the Research and Evaluation Committee of the NORC EMA Planning. And we are going to have a brief presentation on the end+disparity just to mobilize involvement from the Planning Council in the process.
Wonderful.
So we're really excited about this process. I'm also excited about my own role in this learning exchange, where I will be the lead consumer for Partner in Care activities. So I really am really excited about looking at disparities in these 4 populations. Thank you.
Thank you, Dolores. We're really glad and happy to have you, and I think you would be, your voice and your insights will be heard many times over in our future webinars. So thanks so much for joining today. Let's hear from other folks who haven't introduced themselves.
Hello, everyone. Hi, this is Deanna Kreidler.
Hi, Deanna.
With State of Oregon, Part B. And one just quick thing, being that we're Part B, we did not choose the performance measure HIV medical visit frequency. We chose gap in HIV medical visits. I looked at the disparity calculator. It looks like if, I could change the heading and plug the data in anyway. Is that correct?
Yes. You can change that. This is a related question, Dana. The question was posed, if the calculator is protected, can you share the password? Well, there are a lot of calculations in the background, but the fields that you can change are the information about your clinic. You can also change the measures as well as the subgroups, but we want to stick to those 4. If you need to change more than that, if you just reach out to us, we can work something out. It's a free tool we want to make available to everybody. So Dana, Dana, did you plug in the data already, or did you just look at the spreadsheet for the first time?
No, I just looked at it. I have the data. I just haven't had a chance to plug it in yet.
Okay, wonderful. We would love to hear at our next office hours if you wanted to share a little bit what the data looked like and what came out of the discussion, and it would be great to hear a little bit more.
Great.
I know Tiffany wanted to talk earlier, and I see her on the video as well. So Tiffany, do you want to quickly introduce yourself? Sorry to put you on the spot, but you're a very brave one to actually have your video up and running as well.
Hi, Tiffany Hart from Wayne State University, the School of Medicine, Internal Medicine Department.
Tiffany, did you go ahead.
I'm sorry. I took a look at the website, and I was looking in particular for the calendar of events, and I was not able to locate it. So I just wanted to make sure I'm in the right location.
Okay. How about the following? What I'm going to do now is because the question came up a couple of times. So
yes, Clemens, if I could just jump in, Emily Chen and Emily Chu, were able to kind of fact-find and see what happened. So it looks like for the slides yesterday, you actually have to click on the events calendar and go to October 20th and then select the file that way. It seems as though the events calendar moves forward with time, so it doesn't show the old events. So that'll be something that we'll correct moving forward. But for now, if you just click on the actual calendar, you can see the file as well as the details about the webinar that occurred yesterday.
Yeah. So if you want to, guys, what I'm going to do is I'm actually going to shift and show my screen. For those of you who are on the webinar, you can see here. This is, and Emily, can you quickly confirm that you actually see my browser?
Mm-hmm.
Yes, very good. So if you go here and you see here the various tabs, it was already pointed out here, down here, there is our video access. So by clicking it, it will start playing. If you go on the events section and then view our event calendar, by clicking up here, you see here by going to our various, so this will be the call for next week, you get all the access information. I was actually reminded that if you click on the arrow button going back once, you actually see here our webinar from yesterday. And by clicking, if you look at the cursor here, you can actually access the webinar slides. It's probably something that is probably a little bit hidden too much, and suddenly we can think about putting it more prominently. But so if you go on there, just to do it one more time, if you go to events calendar, and then go back, you can actually access the slides from yesterday. We've done this yesterday as well, so if you're very keen, you need the slides right away, you can also put your email address into the chat room, and we can just email quickly them to you today. Who else do we have that didn't introduce themselves as of yet? Anybody else?
There was just an additional question from the chat box from Ellen. I was just going to type back a response, but a couple of these questions came up yesterday. The question is, when I go to the events calendar, it seems that the webinars require no registration and only the April and May require registration. I know that there was a glitch with our events calendar yesterday to register, and so that's something that we're working on. It was the original intent that all webinars would require registration for evaluation purposes, so we would just ask that maybe in the next week for you to go back to the events calendar when that's corrected. Clemens, any update about that we can share?
No, I think it's just to be a reminder that our monthly content-rich webinars should require registration. We want to keep tap a little bit, as you said, Emily, but the office hours don't, so therefore registration is required. It is requested for our monthly webinars. That's usually the third Thursday in the month. Sorry for that yesterday. We tracked it and we tried this out a couple of times, so we just have to check it out, and we started looking at that yesterday. A question was also posted, I see here from Christine, about the intervention grid. So very quickly, we have one of the things we did as part of getting ready for our launch is to look at interventions that are evidence-based or evidence-informed about how to get started for each of the 4 subpopulations. And the question is, how did you determine that these interventions were effective? So basically what we did is we looked at the literature that's in peer journals. We looked at the various SPINS projects and looked at their proven interventions. And then we compiled them all in a list and tried to categorize them. So we tried to find those that you can do them in realistically over the next 9 months. We chose intervention that you can realistically do with the resources. So if it requires to hire a whole new sort of staff, we decided maybe not the right interventions. But if you go through that list, the links and more details are provided. So if you go to end+disparitiesexchange.org, click under interventions, and then you can literally find the one intervention that you may want to take a closer look at. Just try it out, take a look at them, and see what fits to your local environment. Do we have any other questions, any thoughts, any other reflections about our learning exchange, things you tried out, things that you found helpful so far? Let's hear a little bit. I want to pose a different question, and then maybe that was would be lovely to hear is any of your programs actually have done some work regarding addressing disparities in your HIV population? And has some of your programs actually started that already? And we would just love to hear some of the things that you tried out, maybe how you determined what is a disparity, talked a little bit about the intervention, your PDSA cycles. So anybody tried already some work regarding disparities? And if you can just unmute your phone and quickly introduce yourself, we would love to hear from you.
This is Lydia from Emory University in Atlanta, Georgia. We're currently working on viral load suppression. I'm looking through the slides and the information. This is going to be really, really good. I also was looking at that calculator. I think I will need to use that for our next meeting, which is scheduled for next Wednesday. We are looking at MSM of color. That's where our disparity lies, as well as the 13 to 24 age group. So yeah, this will be definitely helpful.
Lydia, a quick tip for you. It would be great if you go to your next meeting, as you suggested already, bring the data and actually enter the data as part of your presentation, and actually go to the tab where it says viral load and retention results. Okay. And then you will see that you see a clear result. Let me just quickly go, for those who did not join us yesterday, I will have a quick screenshot of the calculator. So you can see a little bit in very simplistic terms. So here is a screenshot. You can see this is our disparity calculator. It allows you to enter the data over here. So here are the empty fields that you need to fill out. And then it actually, so then you fill them out up here very simply. And once you do that automatically, the calculator will determine based on the information that you entered, and this is for viral load suppression, where disparities are occurring. And this may be, so for you, Lydia, would be a great way to start a dialogue, because once you have that information up, is our assumption that disparities occur in MSM of color and youth, is that really supported by the data? And that would be a good starting point for further discussions.
Okay, great. Thank you.
Anybody else who did some work regarding disparities?
Hi, can you hear me?
We can hear you loud and clear. Hi, Terry.
Great. This is, hi, how are you? This is Terry. I am a member of the New Jersey team, and I am equality manager for Middlesex. I just have a question, and I apologize I was not able to join everyone yesterday. The disparities group, with the exception of one, I think I'm worried that we're not going to have anything, but we might have other disparities groups that we're interested in, such as foreign-born women, and there are other groups that we have identified in our area, and I'm wondering if there is any wiggle room, or do you want us to stick with these groups, at least?
I think, okay. I think, Terry,
yeah, I think I'm done, yeah.
So Terry, I think you bring a good point up about why we'd be focused on those four groups and aren't there other disparities occurring in other subpopulations? And the answer is there are definitely occurring in other populations, and such as, you know, whether you think about urban versus rural in a larger Part A, Part B setting, whether it's substance use, mental health. For, I think, as a starting point to look at this, we really tried to ask you to look at those four subpopulations first. One of the reasons is because we have all our interventions, our data systems, and other things that we want to make available, our webinars, will focus on those four subpopulations.
Okay.
And I think it's just because we can help you with those probably a little bit more, recognizing that disparities are much more complex, and probably there are other drivers and probably other factors involved. Ideally, if you can start with one of those 4 groups, we also know that most likely your data systems will allow you to use the disparity calculator right away. It may take you a little bit longer to write a list out who has substance use, mental health, housing, and other behavioral issues that may drive higher or lower viral load suppression, and determine that. And that may be it will take us probably more to figure those out. And by the time we would do that as a community of learners, it may take us more time, and the 9 months would be over. So my recommendation is start out with those 4 groups, see what you can learn, use the tools we have, and then obviously as any kind of journey, you come to a crossroad where you need to make a decision. Well, we try to address that, but we want to be further, but that's certainly something that we encourage you to look at as well. But ideally, let's stick with the 4 groups right now, and then we can work further in the other directions.
Sounds good.
Any other questions, any other thoughts, any other reflections? Emily, do you have any other comments from your perspective, from HAP's perspective about this initiative? And then maybe we can go a little bit into the next steps for our learning exchange.
No, I think you pretty much covered it, Clemens. I'm excited to be a part of both the Learning Exchange webinars and the office hours. My contact information and NQC's contact information has been shared, so feel free to let us know throughout this process if there are any questions or anything that we may do to help facilitate this process. In the meantime, before our first webinar on November 17th, I invite you to poke around and look around on the end+disparities exchange website. Like we had mentioned, it's really well done, and there's a lot of really great materials on there for you to learn from, and feel free to reach out if you have any questions.
Wonderful. Thank you. So we will have office hours next week again. That's the October the 28th. We'll continue with our next content webinar on November the 17th. All those dates can be found on our end+disparitiesexchange.org website. I think where we are in our arc is that check out our resources. Maybe you want to schedule or use the resources at your next quality meeting, show the video, plug in the data in the disparity calculator. I think that's what we encourage you to do. If you have any questions, please feel free to reach out to us here at the National Quality Center. The best email address to reach us is at info. I'm actually going to type in, Emily, if you can quickly type in that email address. It's at info@nationalqualitycenter.org. We can respond back to you fairly quickly. As you probably know, our phone number here is 212-41, actually, the email address as well as phone number. Feel free to call us. My personal email that you can certainly send an email to me directly is at clemens@nationalqualitycenter.org. I'm happy to answer any and all your questions. So we're looking forward. It was great to see. We had so many participants already yesterday. I think it's very timely with this activity. And as I mentioned earlier, that ending disparities will really help us to end the HIV epidemic, and I think we're all making together a really important step in the right direction. So I welcome all of you. Thanks so much for participating today. I will stay and hang on for a couple more minutes here on this webinar. If you were, it didn't come up yet as a question, I'm certainly take any of your questions already. I'm happy to answer them right now, and otherwise you can just contact us. Thank you so much for joining us today. I wish you a happy Friday and a wonderful weekend. Thanks so much for participating today. Thank you.
Thank you, Thomas.
So this is Clement Steinberg. For those of you who are still on, if you have any questions, please feel free to ask them. I know we officially closed our office hours, but if you want to, I'm happy to take your question at this point. It appears there are no more questions, so feel free to contact us. Thank you so much for participating. Thank you.
Clemens, do you want me to end the session?
That would be great. I think I can do it here. So.
Okay.